Hello friends, from today we will start with the mineral metabolism. Today's topic of discussion is calcium metabolism. This is very important. This is asked in the long answer question in the university exam, and in several times the case study also comes. We will discuss the calcium metabolism under the certain headings. At first, intro, then sources, RDA, functions, absorption, regulation, and the clinical significance. In the clinical significance, we will discuss about the hypocalcemia and the hypercalcemia. Start with the intro. Total calcium contained in our body is 1 to 1.5 kg, in which 99% of calcium is present in the bones and teeth, while 1% calcium is present in the extracellular fluid. Sources of calcium. Milk and milk products are best source of calcium, while beans, cabbage, leafy vegetables, fish, egg yolks are some good sources of calcium. Now, RDA of requirement of dietary allowance of calcium for adult man and woman. (800 mg per day calcium is required, and for children 1 to 18 years 0.8 to 1.2 gram per day. For women, lactation and in post-menopause condition, 1500 mg per day is required. The functions of calcium. The functions of calcium we can remember by the certain mnemonic BCCCI mans have heart. Now discuss this mnemonic. First function is the development of bone and teeth. Calcium along with phosphate is required for the formation of the hydroxyapatite and provides a strength to the skeleton tissues. And calcium is also required for the mineralization of bone. Second function is the muscle contraction. Calcium, it interacts with the troponin C and trigger the muscle contraction. It also activates the ATPase, which increases the interaction between the actin and myosin. Third function is the blood coagulation. Calcium is the fourth clotting factor, so it is required in the several reactions of cascade process of the blood clotting. Fourth is the colmogulin mediated action of the calcium. Calcium, it binds with the colmogulin. Colmogulin is a calcium binding regulatory protein and form the calcium colmogulin complex. Now this calcium colmogulin complex, it activates the certain enzymes like the protein kinases, adenylate cyclases and the myosin dependent kinases. Now this active protein kinases, it phosphorylate the several enzymes which actually present in the dephosphorylated state. Now these phosphorylated enzymes play the important role in biological functions. Fifth is the membrane integrity and permeability. Calcium plays an important role in membrane integrity and permeability by transporting of the water and several ions across it. Six is the calcium act as the intracellular messenger. In certain hormones, action of calcium is certain hormones activation, their action is mediated by calcium instead of the cyclic AMP. Like for the liver glycogenolysis epinephrine role. In this, calcium acts as a secondary messenger, while in ADH, firstly through the CMP, then calcium. So, role of calcium is act as a third messenger. Seventh is the activation of certain enzymes. Calcium directly activates certain enzymes like the pancreatic lipase, ATPase, and the succinate dehydrogenase. And for eighth function, nerve impulse transmission. Calcium play a role in the transmission of the nerve impulse. Ninth function is secretory process. Calcium act in the microfilament and microtubule activated process, and it activates the endocytosis, exocytosis, and several. And 10th function is the release of hormones. Calcium, the release of certain hormones like the calcitonin, parathormone is facilitated by the calcium. And last function is the action on heart. It acts on the myocardium and prolongs systole. Now discuss the absorption of calcium. The absorption of calcium is mainly absorbed in the duodenum by the active process which is energy dependent. And several factors which increases the calcium absorption and which decreases the calcium absorption. The factors which increases calcium absorption. First is the vitamin D. Vitamin D, through its active form calcitriol, it increases the calcium absorption. Second is the parathormone. Parathormone, it also increases the calcium absorption through the increased synthesis of calcitriol. Third is the low pH, meaning the acidic environment is also favorable for calcium absorption. Fourth is lactose. It promotes calcium uptake by the intestinal cells. Fifth is the certain amino acids like the lysine and the arginine facilitate the calcium absorption. Now discuss the factors which decreases the calcium absorption. First is the phytates and the oxalates. The phytates and oxalates form the insoluble salts and interfere with the calcium absorption. Second is the high dietary content of the phosphorus. actually high dietary phosphate, it forms a insoluble calcium phosphate salts, high content of phosphate, and it prevents the calcium absorption. Third is the free fatty acid, they also form the insoluble salts. Fourth is the alkaline environment, meaning high pH, it also unfavorable for calcium absorption. Fifth is the high content of the free fatty acid. They decreases the calcium absorption. Now the factors regulating the plasma calcium level. Normal concentration of the serum calcium is 9 to 11 mg per deciliter, in which 50% serum calcium is found in the ionized form, which is a biologically active form. 40% serum calcium is bound with protein, especially with the albumin, and 10% serum calcium form complex with the phosphate, citrate and the bicarbonate. The serum calcium regulation is by 3 hormones. First is the calcitriol, second is the parathormone, and third is the calcitonin. The calcitriol, the physiologically active form of vitamin D, is calcitriol. The calcitriol, its action on the different tissues can be seen firstly on the intestine. Calcitriol increases the transcription of the calcium binding genes. So, increase synthesis of cal binding protein and increases the calcium absorption. Second, on the bone, it stimulates the osteoblast cells. Which causes a mineralization of bone and increases the calcium absorption. Third, action on the kidney. It increases the calcium absorption as well as phosphorus absorption. Now by regulation by the parathormone, PTH. Parathormone are secreted by the 2 pairs of the parathyroid gland. The prime function of parathormone, it is to increase the serum calcium level. Its action on the different tissues, firstly on the bone, it stimulates the osteoclast cells, which increases the activity of pyrophosphatase and the collagenase. So, bone resorption increases and demineralization of bone increases and the serum calcium level increases. Second, action on the kidney. Then parathormone stimulates the 1-hydroxylation of the 25 hydroxylase hydroxycol calciferol. So calcium absorption increases and serum calcium level increases. Now action on the intestine. Its action on intestine is indirect. It increases the intestinal absorption of calcium by promote the synthesis of calcitriol. Third, by the calcitonin. Calcitonin is secreted by the parafollicular cells of the thyroid gland. The action of calcitonin is the antagonistic to the PTH. The action of PTH is to increase the serum calcium level, while the action of calcitonin is to decrease the serum calcium level. Its action on bone is it decreases the mineralization of bone. So it decreases the serum calcium level. Second, on intestine, it decreases the intestinal absorption of calcium and phosphorus. Third, action on the kidney. It decreases the reabsorption of calcium, so increases the excretion of calcium in urine. Now, clinical significance, meaning the diseases. In this, we will read about the hypocalcemia and the hypercalcemia. The normal serum calcium concentration is the 9 to 11 mg per dl. If there is fall in the serum calcium level to below 7 mg per dl is the case of hypocalcemia. It is a serious disorder and it can be life-threatening. Now the symptoms of hypocalcemia can be remembered by a mnemonic CATS. C refers for the convulsion, A refers for the arrhythmia, T refers for the tetany, and S for muscular spasm. Now, what are the causes of the hypocalcemia? Rickets, osteoporosis, osteomalacia, hypoparathyroidism, and medullary carcinoma of thyroid. What is rickets? Rickets is a defective mineralization of bones. It can be either due to low level of the vitamin D or due to the dietary deficiency of both calcium and phosphorus. And increase in the activity of alkaline phosphatase is the characteristic features of the rickets. And now the treatment of hypocalcemia. Supplementation of oral calcium with vitamin D. Is commonly employed, and in several cases of hypocalcemia, calcium gluconate can be administered intravenously. Now discuss about the hypercalcemia. Increase of the serum calcium level beyond the normal ranges can lead to hypercalcemia. And what are the Causes of hypercalcemia are the hyperparathyroidism, or in the patient of urinary calculi. In the urinary calculi, there is increase in the excretion of calcium and phosphorus. Now, what are the symptoms of hypercalcemia? Irritability, loss of appetite, lethargy, meaning laziness, nausea, susceptibility to fractures, myocardial contractility, etc. Thanks, keep watching. If you like my video, then please subscribe.